Good evening, Dr. Medina and my fellow colleagues. My name is Jennifer Champa. I am in FNP 597 at United States University. This week's soap note is based on cardiovascular, whereby I had a chance to meet Mr. JD at our clinic, who came in today unaccompanied. Is a Hispanic male, reported to us with a problem. He is 57 years old. Date of birth is May 14, 1968. Chief complaint was, I have chest pain and get shortness of breath when I walk. Based on the HPI that we conduct, was that he was having intermittent chest pain and exhaustion dyspnea for the past 2 weeks. The onset was slow, and then the location was the substernal area, which extended to the left arm, and the duration was 5 to 10 minutes, and it feels like a pressure like on the chest. When he does walk up the hill, it gets worse, but when he rests, it relief, or maybe that is the relief that he does has. He also had diaphoresis, fatigue, but denies complaint of nausea, palpitation, or vomiting, and any other syncope. He is currently on a medications with for hypertension and hyperlipidemia. The pain level he experienced is 6 out of 10. Currently, medication that he has is Lisinopril 20 milligrams, and atorvastatin 40 milligrams, and aspirin 81 milligrams. Based on the allergy wise, he does not have no allergies to any medications, environmental, or any food. The past medical history is a hypertension, hyperlipidemia, and an obesity. He also did colonoscopy in 2021. Flu and all vaccinations are up to date. The surgery that he has ever had at the age of 25 was appendectomy, and has not been hospitalized for the past 10 years. Father died with MI, and the mother is a type 2 diabetes. He's a truck driver who does smoke heavily, smoke 1 pack of a cigarette a day, and has been smoking for the past 30 years. He does drink occasionally, and he deny any illegal drug use, and he does drink a coffee, 2 cups of coffee a day. When we get to the brows, we did the constitutional, where he reported fatigue but denied fever, chills, any weight loss. The eye, there was no vision changes. There's no deny any hearing or anything. The vascular that he does report, chest pain and shortness of breath, deny palpitation and syncope. The pulmonary that he also was reported shortness of breath with exhaustion, but no cough, no wheezing. The GIGU denies everything. Musculoskeletal, the skin, psych, endocrine, and the hematology or lymphatic, and the allergic situation were all denied with any problems. His obesity weighed at 98 kilograms. BMI was 32. Blood pressure was 158/92. So when we get to the physical assessment that was conducted, he was alert orange to 3. There was no distress or anything that appears on him. He also has a good pallor, was all intact, no JVD. Cardiovascular wise, has a normal rate and a normal rhythms. Normal S1, S2, no murmurs, no raps, and all positive upper and lower extremities. Respiratory wise, bilateral was clear sounds, no wheezing, no crackles, no bronchi. GIGU was all normal, no tender, no nausea, vomiting, no diarrhea, soft abdomen. GU also has not been seen any blood in the urine. Musculoskeletal, all joints were movable. There was no issues on that. And then neuro-wise, it was a little orange 3. Psych was adequate, a very eye contact during the assessment. Special tests that we conducted was EKG, troponin 1, lipid panel, and then fasting glucose. Based on our assessment and the differential diagnosis that we came out with was stable angina pectoralis, and then acute coronary syndrome. The third thing was GERD, which is gastroesophageal reflux diseases. So based on the primary diagnosis that I came out with for Mr. JD was the stable angina pectoralis. So when it comes to the plan that I and then the preceptor decided to do was to repeat the EKG just to check if there's any other ischemia or maybe any development of coronary artery diseases. We also put on a high sensitivity troponin 1 just to follow up the guidelines, and then do refer also, which we plan to refer him to see a cardiovascular for any stress test or maybe any stress exercise that he has to do. And then we also try to do the lipid panel. Medication treatment, nitroglycerin 0.4 PRN also was given to him. And I advise him that if he is feeling that chest pain, he should take 3 doses every 5 minutes interval. And if it doesn't stop, he got to rush to go to the emergency room. We also upgraded the atorvastatin for the lipid for the high cholesterol, in the sense that from 40 we had to increase it to 80 milligrams for any further cardiovascular issues that he might be experiencing too. We also heavily educated him to continuously taking his medications, and then has to modify the way that he eats, and then have a smoke cessation, low fat, low cholesterol, low sodium were also highly recommended for him. We advise him to follow us back within 1 week to follow up if he does experience all of that, or if needed to be referring him back to cardiovascular, or maybe to cardiologists. So based on the assessment and then everything that we did, we had a very good history, and then we were able to conduct and then educate him with a lifestyle cancellation and any cardio issues that he can come across. So in terms of the visiting that we had with Mr. JD, it was very successful, and we were able to potentially accurately identified the life threatening for Mr. JD. Thank you.